si Axel Alterado. Si Axel is also faculty at LaSalle. He graduated from the Masters in Health Social Sciences program. He also teaches in that department now. And he's also now working at USAID Reach Health, local health systems program project. No? So we asked him to talk about how they work in terms of local health systems development and possible interfaces and funding mechanisms, no, funding arrangements that might happen between donor-funded projects and the academe or individual academics. So palakpakan ho natin si Axel Alterado. Axel?
Thank you, Doc Elmer. Magandang hapon sa lahat. Ako si Axel. I'd like to do some shout out to Doc Bien. Doc Bien was my boss in the Zurich Family Foundation, and he's also part of the group where I belong doon sa Social Development Research Center project on COVID-19. No? We're studying now yung different experiences ng families, no, in the life course. So let me just share to you guys.
Hello? Nag-freeze ba si Axel? Can you hear?
Being part of donor-funded projects, as well as leading some of those projects. When I was in the Zurich Family Foundation, we had this funder, the Christian Gerard Gibson Foundation. It was a Switzerland-based foundation, was really interested into nutrition. So I led that project, and Dr. Bien was my director that time. Now I'm part-time teaching at the LaSalle University, and at the same time doing some consultancies. I'm also currently an advisor sa USAID. USAID yung donor, si RTI International yung organization. Okay, but let me just provide you some background. In every donor-funded projects, it's working on a process. We call that the program life cycle. I'm pretty sure a lot of you guys know this already. Let me just share to you where can Academe really get into the picture. So, of course, in every project, if you want the project to really be somehow hitting its goals, a lot of studies have told us the need for us to really follow a process. So you need to do needs assessment. It can be done through internal or external assessors. In small organizations, usually needs assessment is just done by the internal people involved. They can do it by, say, doing consultancy sessions, doing focus group discussions. Now, after the needs assessment, you develop your change model, right? So what needs to be done? What are the interventions? What are the strategic approaches? And then you plot your indicators. How would you know that your interventions work? Well, primarily, you need to lay down your monitoring and evaluation plan. And when you already identified the indicators, success indicators and the performance indicators, from the input to the output, to the impact, to the outcome and the impact, and then you need to do a baseline survey, because this baseline survey would tell us which specific areas to focus on. After that, of course, there will be implementations, monitoring, and evaluations. So where can Academe enter, and really help organizations? So one is, actually, Doc Ben mentioned a lot about it, yung external consultancy for needs assessment, especially in big organizations, in donor-funded organizations or projects. They really need to have a data that has rigor, all right? That's why they are hiring consultants. And oftentimes, yung mga universities kasi, yung mga academe, meron tayong mga extensions or mga research centers, for example, no? Alam natin yung Robredo Institute is also a center, di ba? Na pwedeng i-contract out when donor-funded projects need some help. And then external consultancy for baseline surveys, external consultancy for knowledge product development, right? So when we do programs, it's important, right, for interventions to be really effective and context specific, right? So the academe can really help on that because we are somehow may scientific way tayo of really examining ano kayo mga knowledge product that works best. Of course, external consultancy for module development and training. Si Sir kanina from BARM, no, really shared a lot about training interventions, no. And of course, yung pinakagamit talagang academe, yung external evaluations, no. Midterm or formative evaluations, that's usually sa middle of the project. You need to somehow know if you're on track or not, no? And through midterm or formative evaluation, you'll know, and you'll answer specific questions on the project. Is the project intervention really relevant? Is it effective in a way? Does the output produce outcomes? No, so on and so forth. That can be answered by formative evaluations. Final summative evaluation, and of course, ex-post evaluation. Final summative is after the project, and ex-post is usually 3 to 5 months after the project. So why do donor-funded projects get people from the academe? Primarily because they do not want they want to control the bias, you know, because if you evaluate your own program or project and then kung mag-scale up ka na ngayon, may model ka, di ba? May intervention model ka. If you're going to scale that up, ibig sabihin you're going to institutionalize that at the government level, no? Mas makapapaniwala if the evaluation was conducted by external consultants, especially kung yung academe ay may integrity. Sige, babilisan lang, no? So itong process na to, I'd like to contextualize that in nutrition. So ito yung data, alam natin to, Philippines is fourth in the Southeast Asian region in terms of stunting. Stunting to yung chronic undernutrition kasi walang makain, may infections, no? 1 in 3 adolescent pregnant Filipino is nutritionally at risk. 1 in 2 adult pregnant Filipino is nutritionally at risk. And 1 in every 3 young Filipino children is below average height for age. Ang ibig sabihin nito, andyan pa rin yung malnutrition, no? Problematic pa rin. And I'd like you guys to focus doon ngayon sa usapin talaga sa stunting. There's a special attention being given to stunting ngayon because 1, it's chronic. 2, there has to be really careful consideration with yung sinasabi ni Doc Ben kanina, yung whole issue of social determinants, no? Kasi kahit i-cure mo yung disease, no, that brought infection and brought the malnutrition, kung ibabalik mo siya, no, sa communities na kung saan walang makain, no, walang palikuran, and then babalik pa rin yung infection, babalik pa rin yung malnutrition. So it becomes chronic. In fact, no, nung tiningnan natin yung trend ng data for how many years, no, I think that's 2 decades. If you can see the stunting, it's really 3 of 10 children are stunted. It fluctuates, no, on that level. Noong 2015 to 2018, for example, sa survey ng National Nutrition Survey, 1 percentage point decrease lang per year. And if we want to really achieve our target of 21.4 by 2022, then we need to have around 2.2 point reduction per year. So yun yung medyo challenging. And in fact, this begs the question of what are we doing over and over again that's not working, no? And what do we need to do? Something new that we need to do. So tiningnan, of course, one way to answer that's really to see which certain areas with really high malnutrition problems. You can see in this slide, um, these are the provinces with high prevalence of stunting and poverty incidences. No? Kung dyan naman kayo, kung meron kayong mga areas dyan, no, especially the right upper quadrant, ito yung mga problematic talaga and really needs attention. Del Sur, Sarangani, or somewhere. So how do we solve this problem? In fact, no, in 2008, the Lancet framework was released. No? This was somehow written by scholars from the World Health Organization. Ang gusto ko lang i-highlight dito, life course approach siya, nagpo-focus siya sa first 1,000 days of the child. So from the pregnancy to the first 2 years of the child, kasi yun yung critical period where the brain is really rapidly developing. And if you miss that period, you'll miss the chance, no, of that child to really to have an optimal growth and development, cognitively and motor aspect. So there's a nutrition specific, nutrition sensitive, and enabling environment. So summarize ko lang through this Philippine Plan of Action for Nutrition. No? Yung Philippine Plan of Action for Nutrition mentioned kanina by Sir Sir Noel. Yan, it's anchored on the Sustainable Development Goals, pero meron siyang mga mga outcome indicators dyan, no? Specific outcome indicators talaga. Pero at the end of the day, may mga programs na kailangan natin i-suffice. No? And so ito yung mga nutrition specific, ito yung mga interventions that can immediately have an impact to the child. Yung mga pagkain, mga micronutrients and all. Meron ding nutrition sensitive, ito yung the whole lot of social determinants. No? Hindi siya directly makapag-ano ng nutrition, but if you're going to improve that, education, sanitation, food production, social support, no, and protection, and then eventually it will have an impact on malnutrition. But ang question dito ngayon is how to facilitate meaningful action from the LGUs, right? Because at the end of the day, the battle is really at the local level. We can always, propose policies, pero kung hindi naman ginagawa ng LGUs, and wala din. And I think, and I believe Doc Bien already emphasized kanina, na a lot of leaders were really not into malnutrition or health kasi in the first place, hindi siya facility, hindi siya something na makikita agad, and hindi siya masyadong sa mata sa mga butante, no? Ganun siya. So bakit may challenge ngayon sa implementation ng nutrition programs and nutrition-related programs sa local level, no? Actually, in reality dyan, there are programs na related to malnutrition, pero they're working in silos. No? This is what Doc Ben was referring to. Agriculture has its own program, health office, they have their own programs, and they're not hitting the strategic population, which is the first 1,000 days. All right? So you need a holistic program, kailangan mga social welfare dyan and all, to hit the first 1,000 days so that there will be optimal development. Kaso nga, patsa-patsa, masyado siyang silos. Ito yung mga challenges dahil unang-una, bakit patsa-patsa? Because the leaders don't see it that way. Malnutrition is just normal. It's just there, di ba? Hindi naman nakakamatay yan. And then yung pagiging bansot is, a Filipino trait, di ba? Yun naman sinasabi nila. So from their leadership, mindset pa lang, wala na. So merong high malnutrition. So what we did in my project sa Zilig Family Foundation, in partnership with Christian Jacobson Foundation as the donor, we developed a roadmap where we guide leaders how to fix their local health nutrition systems. No? And the one helping us on that was UP College of Public Health. No? We co-created with them the M&E Scoreboard Development for System Strengthening. But the first did needs assessment. No? So participatory process yan. Nag-needs assessment muna, nag-come up ng proposals, diniscuss yung results, and then we co-created the M&E scoreboard na ang mga leaders talaga ang may say. No? Kaya ko to, hindi ko to kaya. No? i-commit ko to, hindi ko to i-commit. So nagiging participatory process siya, and UPCPH was really elemental to that. Another one was our partnership with UPLB, Institute of Human Nutrition and Food, because we saw the need for also our service providers to learn the integrated service delivery for nutrition. No? For long, our barangay nutrition scholars are somehow very confident with measuring height and weight. They're doing that annually. We call that anthropometric measurement. But the question now is, if they have that data, what can we do? And in fact, they are limited into their competencies. So if they know that there's a stunting in one barangay, in one community, so what can be done? And in fact, they can't answer really that. No? They'll just, say, mother, kailangan mong pakainin siya ng ganito, maganyang simple advice. So we taught them several disciplines. And of course, ang pinaka-importante dito was the integrated referral system. So if ever may stunting, tapos walang pagkain, tapos mahirap talaga, merong process wherein they can refer that family to certain agencies. No, walang process na ganyan noon. We call that process the Nexus process for nutrition. And in fact, we created manuals on that. We created the municipal mayor's guide for the mayors to fix the system. In terms of the service delivery and referral, we also developed manuals to guide our service providers. So yun yung naging role ni UPLB. Ang sabi ko kay UPLB, Dr. Africa, for Africa here, the leftmost woman here, director ng IHNF. Kasi they've been engaged by NNC for long they've been developing technical manuals, no? Pero sa systems, hindi pa masyado nilang, tinatakot. So sabi ko, challenge ko siya, di ba? Ganito ako yung approach ko nung I was leading a donor-funded projects. Ano pang gusto ninyo, nakikita nyo na dapat gawin na hindi nyo pa nagagawa? Gawin natin. So yun nga, we came up with that idea of the Nexus process. So eventually, combined with other interventions, we're able to really improve the nutrition in these sites. Improve the implementation sites had improved child anemia, maternal anemia data, stunting, and wasting. I'd also like to share, kasi I'm now in the LSU, I was part of this qualitative process evaluation. That's a Barangay First 1,000 Days another right start intervention in the Philippines implemented by Nutrition International and Helen Keller International. Ang ginawa, kasi ako dahil sa Zoili Family Foundation work ko, nagkaroon ako ng network, okay? So kilala ko na ngayon si NI, and because I was already teaching sa De La Salle University, and there ang NI was looking for collaborator in terms of conducting the midterm eval, the process evaluation, and then they saw me to lead that. So kaya in-engage ako through the SDRC, the Social Development Research Center, under ng De La Salle University. So of course we again recommended the need for systems-based approach na sinasabi ni Doc Ben kanina. Governance, financing, human resources, and a lot of that. And the need for also integrate social determinants in our interventions and nutrition. Kasi puro pagkain, no? Puro counseling, no? Pero hindi nag-attend yung mga mothers sa counseling na yan kasi nga kailangan nila magluto. They need to do some income generation as well. Kapag hindi sila makauwi sa bahay alas 12 ng lunchtime, walang nagluluto. Papagalitan sila, bububukin na nga lang asawa. So, they'd rather not attend this kind of activities. No? So yun yung naging recommendation natin sa Nutrition International. Another challenge that I'd like to share to you, lapit ito, Doc Elmer, no, is yung whole issue of fragmented Philippine health system, which Doc Ben was really referring to. Because hindi nga connected si munisipyo and the province, may autonomy si munisipyo at si province. Usually, nagkakaroon ng problem in terms of referral system, in terms of financing. No? May broken dot kasi yan dito si Provincial Health Office, wala siyang talaga say kay Municipal Health Office. No, so there are 81 provinces and 33 highly urbanized cities. Now, based on the 2018 Philippine Health Systems Review, this arrangement still perpetrates a lot of maternal deaths, a lot of neonatal deaths, and a lot of preventable deaths. So because of that, there was a proposal through the Universal Healthcare Law to integrate this system under the province-wide health system or the PWHS. So masyadong matagal na if I'm going to discuss this technically, but ang gusto kong i-highlight dito is that there are already organizations and projects doing support in these integrations. DOH and PhilHealth by law, is bound to really support provinces that are deemed advanced implementation sites. So as of March 2020, there were 33 advanced implementation sites for that integration, and DOH provides around mga 1.5 million to 3 million as seed fund lang, and it can be added pa. There can be more, para ma-jumpstart. And DOH and PhilHealth also provide some technical assistance in the integration. But hindi nila kaya lahat yung integration na yan. Kasi you integrate the system from the service delivery, di ba? Financing, human resource, ang dami kasing kailangan mo i-integrate. And thus, kailangan mo ng mga donor-funded projects to assist in some areas. So, andyan si USAID, which I'm part now, sa RTI International. I'm handling 6 regions now in Luzon. ZFF also is doing that. Think well as well. Pero ang question dito is, 33 lang advanced implementation sites. Anong mangyayari sa ibang areas, Kasi may total tayong 81 provinces and 33 highly urbanized cities. Who can help them? And in fact, yun yung naisip ko, baka nga pwede dito sa Academe. Ano ba yung magandang arrangement where Academe can really help? So how can the Academe help possibly? In terms of service delivery, isa kasi sa usapin dyan is the disaster risk management for health. Kailangan nilang tulong in terms of really creating that plan, especially in this kind of crisis na may COVID-19 tayo, a lot of calamities. Taal Volcano is level 2 now. Health promotion, referral systems, and of course, studies on quality of care. Under the universal health care, sobrang malaking usapan yung quality of care. Okay? Kasi we might be somehow providing commodities, pero yung quality of care in terms of attitude of workers, okay ba yun, di ba? In terms of the waiting time, ganyan, ng mga patients sa ating facilities. So, nagiging usapin yung quality of care. Sa human resource, of course, yung continuous capability development, maraming mga disciplines nag-emerge, and then there's also attrition rate. In terms of medicines technologies, usapin dyan yung supply chain management system. Di ba? Academe, kung magaling ka in terms of supply chain system na automated, and then you can really help on this one. In terms of leadership and governance, of course, yung mga studies natin can really help to inform policies. Sabi ni Doc Ben kanina, maraming mga interventions na hindi talaga siya grounded sa policy sa local level. Take that from us. Ang dami. And in terms of financing, of course, for example, sa Batangas, they are doing hospital economic enterprise towards health enterprise where the primary care is integrated to the hospital system. But they need help in terms of conducting that feasibility study. How to do that? Is it really profitable? Is it really effective at the end of the day? Information, ang usapin na ngayon is yung interoperable AMR. There are different AMRs in the localities. May AMR si electronic medical records si hospital, meron si RHUs, Ang dami, minsan confusing, minsan may problem pa sa isang AMR. And then yung patient yung kawawa, kasi default through the crack. So I think ito yung mga important areas where the Academe can help in some ways. So paano, no? Ano yung Academe and donor-funded projects arrangement? Ito yung last slide ko, Doc Elmer. Ano yung basis of demand from donor-funded projects? Unang-una, kung ang project lacks competency. Kung may areas dyan sa food and nutrition or the system that they don't really know much about, and then they need help, no? They need help. Lack manpower, kulang talaga sila, no? Kasi a lot of projects din, meron silang policy in terms of their manpower. Needs to fast track deliverables, no? May mga unusualities, like in pandemic, it really moved deliverables into a halt. It put activities into the halt. So kailangan nila ng tulong dyan. So ano naman yung basis for acceptance for collaboration ng Academe? Okay? So i-accept yan ni Academe usually kung may presence of extension program and yung alignment with BMGs, na yung vision, mission, goals, no? Ng isang department, ng isang center, no? Tapos merong core competency at may experience yung faculty. Of course, hindi ka mag-commit sa isang collaboration kung wala naman kayong expertise din, di ba? And of course, then they need to publish. Yun naman yung drive din ng Academe, kasi from those studies, from those co-creation activities, they can come up with case studies, no? They can come up with publications on that. So ano yung mga arrangements where the donor-funded projects and the Academe can enter into collaboration? Una, consultancy by bidding. Ganito usually kapag mga international organizations, they invite biddings, no, from providers. So kung okay yung proposals niyo, then you'll be accepted. Consultancy na pre-selected. So for example, may network ang donor-funded project sa isang school na yan, no? Kunyari ako, I'm teaching part-time and I have a person na kakilala sa isang organization, no? Pwede niya akong kunin, no, na pre-selected, and we just need to build a case, no? So yung school ang may competency at sila yung mas may alam doon sa ipapagawa natin sa kanila. Yun yung nangyari kay UPLB kasi magaling sila sa module development, no, sa training in terms of nutrition, kaya sila yung pre-selected namin at sila yung may clout doon sa National Nutrition Council. So strategic siya in a way. Ganun mag-isip yung mga donor projects, donor-funded projects. And lastly, yung cooperative partnership. Ibig sabihin nito, hindi contractor si Academe, pero meron silang stake, no, 1:1. May taya si Academe, may taya din si project, and meron silang MOA, no, memorandum of agreement. Especially ito yung mga extension programs, no, natin. Si students, no, will be sent to study a certain area, pero wala namang monetary amount involved. So Doc Elmer, that's all.